Welcome. I'm your host, Deborah Feinstein, and today, as part of our Get on Top of Your Health series, we are speaking with Dr. Katerina Ciappoli, Director of the Comprehensive Breast Program, and Breast Surgery Nurse Navigator Michelle Houston, both of the Cancer Center at the University of Maryland Capital Region Health, part of the University of Maryland Medical System. Welcome to both of you. Thanks for being here.
Thank you.
Thank you for having us.
Let's start with you, Dr. Ciappoli. Just give us a little bit of information about your medical background.
Oh, you're taking me back now to many years ago. Well, this is not medical background, but I was born and raised in Greece, and did my medical school there. And afterwards decided to come over here for the best surgical training in the world. So did my general surgery training in the University of Tennessee, and then pursued a breast oncology fellowship at Brown University in Providence, Rhode Island, and the rest is history. So after that, I've worked at Brown University, Georgetown University, and now University of Maryland.
And what is important about having a fellowship?
I think you definitely gain a lot of insight about the whole process, the multidisciplinary aspect of treating breast cancer. You do experience through training everything that your patients go through, even in the parts that you as a surgeon don't control. And we also learn more about that multidisciplinary approach, as well as learn ways to stay educated and current, and making sure that we do the best for our patients.
Okay, so let's dive in for both of you, because we know that most women know about the importance of breast health and about early detection, but still we know that 1 in 8 women will develop breast cancer in their lifetimes. So talk to us a little bit about the types of screening and preventative measures you offer at your location.
So I think the most important part is getting your mammograms in a routine fashion. I know that we say that year after year, especially every October, but it's definitely still an issue. A lot of women are dealing with so many problems. You know, life gets in the way. And the next thing you know, it's been 3 or 4 years and you have not had a mammogram. We all fall into that trap. So I would say the best and thing that you can do for your breast health is get routine breast exams by your physician and getting your annual mammogram. I know Michelle speaks a lot to our patients about their general health and well-being, and I'll let her take it from there.
Yes.
Yeah.
It's unfortunate that a lot of patients, especially in our community, do not take care of themselves. Like you said, as women, we're very busy. We're taking care of everybody else in the household, and we put ourselves last. So it's just very important for our patients to understand that you have to come first, because if you're not here or you're not functioning correctly, how are you going to help your family? So just encouraging them to not only get their mammograms, but get regular physicals, making sure that they keep their appointments when they're made. The wonderful thing about our the breast center is that we're able to, I actually schedule a lot of their appointments for them. So I take some of that load and burn it off of them. But then it's a matter of them keeping those appointments. So it's just giving them encouragement and letting them know, I'm going to take this burden from you, but I need you to follow through, because you are important. Your health is important.
And if there is a breast cancer diagnosis, there are obviously a lot of options for treatments depending on what kind of diagnosis you get. Yeah. Talk to us about some of the options that are provided in your facility and in your program.
Yeah, definitely. We are very fortunate. I mean, I'm not that old, so I've been in practice for 17 years. So I have seen during that time so many changes and so many new treatments that are available, and such an improvement in the outcomes we get from breast cancer treatment. That is very encouraging. So in our center, we do follow the multidisciplinary approach. So every cancer patient that walks in our door gets discussed at our tumor board. So we get input from all the different specialists. And the main players are the medical oncologist, the surgical oncologist, myself, and the radiation oncologist, but also our social worker, our nutritionist, Michelle. And that helps us kind of put together a good plan of care for our patients that sort of meets them where they are. Sometimes we have all these lofty goals and great recommendations, but that's not something the patient is ready or willing to do. So we have to work with our patients to figure out what is actually going to get done and how they can reach their goals.
What I've heard a lot as I've researched your program is that there really is, as you said, a multidisciplinary team approach, and you just named a lot of the players. It really is a niche that serves not only Prince George's County, but the entire community, Southern Maryland. Talk to me a little bit about the importance of having this kind of a hub in this neighborhood.
Well, it's very important. I mean, up until now, patients were having to travel all the way to Baltimore or going to Virginia to get this type of care. Now we have it right there in their community. I live in Southern Maryland, so I know from my neighbors, they really did not have much of an option until now. But now we have some place where they can come. They're not driving for 2 hours to get care to see one doctor and then have to take another day off and drive another 2 hours to see another one. They can just come down the road and they have all of their physicians really in one building, you know, when we can work it out that way. And there's also, as far as some of our practices also in Brandywine, so we're in the Southern Maryland area. So they're able to get that kind of care closer to home where they're not actually having to take off of work all the time or leaving their families or whatever their responsibilities are for days at a time.
You mentioned a little bit about how you help usher patients through the process. Talk to me a little bit more about that, because obviously a cancer diagnosis is very frightening for people, and I think sometimes they meet with their doctor or a nurse and they, you know, people are talking to them and they're kind of just losing everything. How involved do families get? Do you interact with families? How does that work?
Yes, of course. One thing I love about what we can do is that we're able to have the families come in. When you come into our office and come into a room, there's actually a family room first, and then there's the exam room. Wow. And most of our patients do have their family come with them, and we don't put a limit on how many people can come. So the family is able to ask questions as well. And then I feel with patient education is not just educating the patient, but educating the entire family so that they can work together as a unit to get through this. A lot of what I do is just making sure I'm scheduling their imaging appointments. If I can get them scheduled with the medical oncologist and the radiation oncologist and us on the same day, we really try to do that. And I have people I can call upstairs that will get them in with the medical oncologist, people I can call across the hall that will get them in with the radiation oncologist to kind of coordinate their care. Especially if they're traveling from Southern Maryland, I do want to make sure they only have to make that trip once.
Wow,
yeah,
that's really helpful.
And if I may add something, I think what is important, you mentioned the shock and the shutting off that happens when you hear the word cancer. And that is sometimes may not be obvious. You think the person just next to you is listening to
absorbing
everything.
Yeah.
But we know from experience and from doing this for a long time that that is not always the case. So our goal is to not only have the family involved, but also have them see different group team members during their visits. You know, they meet with Michelle, they speak with our social worker, they speak with the nutritionist, they speak with our surgical scheduler. And all are trained to identify cues as to whether is the patient having some difficulty, is there a barrier that we're not aware of. So everybody, and we meet at the end of the day, so everybody gets to share their impression and their evaluation of the patient, so we're all on the same page.
Your patients also have great resources and access to the entire University of Maryland medical system. What does that mean for cancer care in the community?
I'll start. We definitely want to have the same standards of care throughout the University of Maryland system. So whether a patient is seen in Baltimore or Southern Maryland or Capital Region, they get same recommendations, same level of good care. It also means for our patients that we do have the support of the Greenebaum Cancer Center in Baltimore that has a lot of additional resources, and the patients can consult with physicians there if needed for any advanced treatments, a second opinion for difficult cases, access to clinical trials, and so on. So that expertise is available to us, and sometimes the patients don't even have to travel there.
Let's talk a little bit about breast cancer in women of color, because we know that Black women tend to be disproportionately really impacted by breast cancer. Why is that? And what does it mean when it comes to diagnosis and treatments?
That is something that has been observed, and the majority of our patients at the cancer center are African American, so we do have expertise in treating them. It's definitely it's a multifactorial process that leads to a diagnosis of more aggressive cancers, such as triple-negative breast cancer, and also we identify certain barriers to care, access to good care, not participation in clinical trials. That can sometimes lead to worse outcomes, such as higher mortality, meaning African American women die more frequently from breast cancer that may be curable. So we are working to intervene in all those different access points so that we can improve the outcomes. Michelle, I'm sure that's close to your heart as well.
Heart, yes.
Yeah.
A lot of it is too, like I said earlier, just not taking care of ourselves, putting everything else first. I think a lot of times we're in denial. They might find a lump or something going on, but they just don't want to recognize what it is. It's kind of that mental thought that, well, if I don't get it checked out, then it's just going to go away, or I don't have to deal with it. So it's very much a mental thing as well. And then just having access to care, which is why I love that we are where we are, because we're able to provide that access that they're not necessarily getting somewhere else. Another thing too is just, I hate to admit that there are biases, but there are biases in healthcare, and a lot of times they feel like they're going to be ignored if they have a complaint of something. And just having somewhere where we're actually listening to the patient, giving true patient-centered care is amazing to me. And I think it's going to really help change things and turn things around for the community.
Does the team follow up with a patient once treatment has concluded? Are you in touch with patients afterwards when they kind of say, bye, we were successful, and how does that work afterwards?
Well, they continue to follow up. It's not just a post-op and then you're gone.
Right.
Yeah, they continue to follow up. They're still getting their mammograms. We're still getting their MRIs, whatever imaging is needed, and following up and making sure that at least every 6 months they're having some type of imaging and contact with us so that we can make sure they're still doing well.
I guess the idea is to make sure that quality of life is as optimal as it can be.
Yes.
Absolutely. I think when the active treatment finishes is one of the most vulnerable stages in the treatment process. I think a lot of patients, for good reason, feel like, what now? I finished my treatment. How do I make sure this doesn't come back? What do I do? A lot of patients at that stage have questions, what can I do to help myself? And that's when we introduce, if not sooner, our nutritionist services. A lot of modifiable factors or risk factors have to do with our lifestyle and our choices every day. So we want our patients to be well educated on how to best support themselves in that process.
Well, this has been a great and enlightening discussion about breast cancer. But I'd also like to ask you about other treatments that are provided at the Cancer Center. There is a large scope of offerings for other diagnoses. Can you talk a little bit about that?
Yes, of course. I think University of Maryland, trying to leverage the resources that we have available, has targeted certain cancers that are more prevalent in our area, in Prince George's County and Southern Maryland. So our services through different specialists include care for prostate cancer and other urological cancers, care for lung cancer, colorectal cancer.
I guess lastly, I would just love to hear from each of you about what you would say is sort of the biggest benefit to a patient and her family if she chooses to come to the Cancer Center at Capital Region Health for care. What is it that you guys offer that stands out?
I think we offer a lot of expertise locally, so I think I will definitely want to stress that. We have a lot of resources that may not be available unless you travel really far away, so that's a lot of good treatment options right there. And I think what I always like to have a nice cocoon around my patients. So I want them to feel at home, not to feel stressed when they come to see us, just to feel that it's a place where they can find support and be themselves.
Wonderful.
I was going to say that was my thing. They're coming to a family. You know, we that are working together are all family, consider each other family, and the patients that come in are family to us. We treat them as if they're our own, and that's what they're going to get. And you can tell the patients come back in, they'll come visit even when they're in the building and just say, "Hey guys, I just wanted to say hi."
Oh, so nice. Well, I definitely feel the love. Thank you both so much. I really appreciate it. Great information.
Thank you for having us.
Thank you.
We've been speaking with Dr. Caterina Ciappoli, Director of the Comprehensive Breast Program, and breast surgery nurse navigator Michelle Houston, both from the Cancer Center at the University of Maryland Capital Region Health, part of the University of Maryland Medical System. For more information about the Cancer Center at Capital Region Health, please visit umcapitalregion.org/cancer, or you can call 240-677-8300. And for any additional information on this topic, you can go to WTOP.com and search Get on Top of Your Health. I'm Deborah Feinstein. Thanks so much for joining us.